Hello friends, I'm Ashlyn. Today I would like to present the presentation on a topic of Sprengel shoulder. Sprengel shoulder is a condition where there is a congenital elevation of the scapula. Developmentally, the scapula fails to descend from its embryological position in the neck. Scapula is higher in position than normal and is usually small and prominent. Next we see about the etiology. This may be due to failure of scapular descent from the cervical spine. The high scapula may be attached to the spine by a tough fibrous band or a cartilaginous bar. This is called omovertebral bar. Next we see about the clinical features. The patient present with an elevated shoulder on the affected side. The superior angle of the scapula is seen and felt prominently in the neck under the upper border of the trapezius muscle. The vertical height of the scapula is smaller and medial border appears prominent. There is only slight limitation of abduction of the shoulder joint and minimal interference with function. There may be associated abnormalities such as fusion of 2 or 3 cervical vertebrae resulting in congenital brevicolus or short neck with a low hairline. This combined abnormalities is called Kippel-Feil syndrome. Next we see about the investigations. First, X-ray. In X-ray shows the elevated position and diminished size of the scapula. It may also show a bony bar connecting the lower cervical vertebrae with the supromedial angle of the scapula, and this is called the omovertebral bone. Next, CT and MRI. Next we see about the treatment. The condition is treated by surgical release of muscle and repositioning of the scapula at an earlier age, usually within 6 years. In mild case, we need symptomatic treatment. For moderate to severe cosmetic functional deformity, surgery is best advised between 3 and 8 years of age. However, the prognosis is guarded and the percentage of complications may be on the higher side on the presence of the associated congenital anomalies. Surgeries. The surgeries are resection of superomedial border of scapula, omovertebral bar resection. One procedure involved the following: resection of omovertebral bone and division of vertebral attachment of trapezius, rhomboids and levator scapulae. Scapula is subsequently rotated and translated coadally. Detached muscle origin or then sutured to more inferior vertebral spinous process.